Okay, well, hello everyone. We are here on a Thursday again with Dr. McDougall, as usual. Dr. McDougall, how are you doing today in
Well,
California?
pretty good.
Yeah, you
Well,
look good.
actually,
You,
I woke up today and I thought I was going to be depressed.
why is that?
Well, don't you ever wake up that way in the morning? You think, well, let's see.
Oh, well, yeah,
It's going to be a depressing day. And then what happened is Mary reached over and said, "Would you give me a hug?" I'm
that
serious.
fixed
And
it.
that's not a made up story. So anyway, you answer your question. I'm having a good day, but
Okay,
I planned on a bad day.
you
This is
planned it.
two of
Okay.
my plans.
Oh, gosh.
Well,
Well, it's better than the other way around to get up doing well and plan on a bad day. Anyway, well, Dr. McDougall, it's always nice to see you, and you always look so good and healthy and happy. So I know you enjoy your family. You love being with them, and that's a big part of your life right now.
well, it's the only part of my
It's
life.
the only part. Well, you love what you do also. I mean, you love doing the programs and seeing patients, and
Yeah.
that's part of your passion, right?
Well, it's my whole life.
All right.
Well, I mean, well, we just had, you didn't make the last weekend.
I didn't know. How did it go? How did it go?
It was good. It was really good. We had probably 150 or more people there, and they all had a good time. This was the intensive weekend that we're talking about. It was the week,
Right. Yes, 3 days.
oh, September. Time flies so fast. It was
I
in
know.
September 2017, intensive weekend. We had a couple weekends ago. And, I always start out these webinars. I give a little discussion in the beginning.
Yes.
There's all these people sitting in the audience. And of course, I don't know them, but I tell them I'm sure they all came willingly. But then again, my guess is that a few of you got here uh, you were drugged by a friend or a family member. It wasn't your free will that caused you to arrive. And Gustavo, no matter how much I joke about this, whether we're doing a 10-day program or a 3-day weekend, I always say that. Some of you got here kicking and screaming, but you're going to have fun by the end. And of course, that's the real enjoyment for our staff and all the people around is to see that those who don't understand have their eyes open during the weekend. So it was fun. Now let me just talk for a couple of minutes about my depression. So let me because I actually one of the problems I have is I'm too optimistic a person. And it drives people around me crazy. So it's as I've said to Mary, probably 5 days in our relationship, which now, by the way, is 46 years. There's probably 5 or 6 days you can remember that I was depressed. It's just my nature. But there are a lot of days that I've driven her crazy by being too enthusiastic and optimistic. But depression has been a topic that I've dealt with a lot because patients are really suffering not only from physical problems, but also from, well, I guess emotional or mental or whatever you call it, depression problems. And they don't know any way out of it except for SSRIs, which are Prozac and other antidepressant drugs. They just can't figure a way around it. And of course, these medications have real serious adverse effects and questionable benefits. So anyway, I wrote a newsletter back, and I'll show you now. Now you tell me we can use PowerPoint real well with our new setup. I won't have to print these things out. But I printed out the first page of a newsletter I wrote in 2004. Okay, a natural cure for depression, March 2004. Now I've taken a lot of criticism about this, by the way, especially some of my close friends who are into vegan diets, very healthy diets, full time. Is they are strong promoters of getting a lot of sleep. Because sleep is enjoyable, it's restful, it's beauty sleep, it's for restoration and recovery. So whenever I talk about, look, guys, this idea of telling people to get 8, 10, 12, 15, more hours sleep a day to solve their health problems is not wise. They argue with me, even though we talk about the research that doesn't seem to, or maybe I'm just missing the research that says sleep is so good for you. But anyway, I wrote this about a natural cure for depression in March 2004. It's a free newsletter, and I talked about natural cures being things like sunshine, seasonal affective disorder. When you get lack of sunshine, I used to work at, I used to not work for, but I used to work at Blue Cross Blue Shield of Minnesota, up in the Twin Cities, and I would go there several times, sometimes several times a month, taking care of the Blue Cross Blue Shield employees with our program, and they did real well. But I saw them, as usual, personally, as a physician. I have a Minnesota license, and so I saw them as a physician. And one of the things I noticed more than I saw in my patients in California was a lot more complaints about depression. Of course, I knew about seasonal affective disorder and using light boxes to make you feel less depressed. So I've seen that personally in my particular practice, that sunshine makes a big difference. You need sunshine. You need light. So anyway, there are natural cures, and there are sunshine. Exercise produces endorphins, about the runner's high, and that's good. And food, we haven't discussed that a lot, but there was a lot of work done by Judith and Richard Wordman. I think they were from MIT back in the 80s and 90s on actual neurotransmitters that are in your spinal fluid that are they're more effective and more abundant when you eat a healthy diet. These neurotransmitters, serotonin being one of them, when you eat a healthy diet. So another way to relieve depression is to eat well. But the one that is really effective, and that I talk about a lot, but again, I get a lot of criticism. People kind of pass by and go, oh, well, what is he talking about? Is the one about sleep. Sleep, of course, is necessary to relieve fatigue. You've got to get some sleep, but how much? And should part of your therapy be a major part of your therapy, a major focus of your therapy? Should it be getting, instead of 7 hours of sleep, should it be getting 10 or 12? I say no. And of course, even though the research is, it's not as consistent. I mean, consider the fact that sleep is cost and profit free, so there's not a lot of discussion about it. But it is a therapy that's been recognized, at least 70 years. And that was brought about by some researchers that observed patients would come in that had severe depression, like suicidal. And they'd come in and they'd talk about how they missed a night's sleep and now the depression is gone. So they started doing research, and they found that people who are suicidally depressive, to the point of killing themselves, if you kept them up for one night, about 70% of them were relieved of depression. Again, this goes back like 70 years. I wrote about it in 2004, that too much sleep causes depression, and one way to cure just the mild depression that so many patients I see complain of, or the more severe depression that many patients I see. I remember one lady told me she had such a great life. She had great children, great husband, great home, plenty of income. Everything was wonderful. The problem is that she was ruining the whole family's life because of this cloud that hung over her of depression, and she couldn't get rid of it. And any drugs she tried did more harm than good. And she told me, she said, I listened to your crazy ideas about sleep. I don't think she used the word crazy. You shouldn't use the word crazy. I used your ideas about sleep, and I decided to set my alarm clock. And she said, I want you to know, in the last 2 months, I've only had one day of depression. And that's the day I forgot to set my alarm clock and I slept in. And you can relate to this. If you, for example, on the weekends, you get extra sleep, the days are kind of blue, aren't they? And you remember the times when you didn't get much sleep, say you were in college, studying for final exams and you didn't sleep for 2, 3 days. You pulled all-nighters with your friends. Believe me, after a day or two, everybody was bouncing off the walls with mania. So it works the other way too. Too little sleep will cause mania, and too much sleep will cause depression. Well, how much is enough sleep? The lowest mortality, which is one piece of data I use, the lowest mortality is people who sleep 6 to 7 hours a night. They have the longest chance, the greatest chance of living long. But the research on depression, I've kind of let go. I talk about it to people. I've got many patients listen and decide that they're going to get 5, 6, 7, maximum maybe 7.5 hours a night, and they've changed their whole life just by that one maneuver. Anyway, what is it? September 19th, 2017. Well, that was like, what, a day or two ago? Out comes this article. Can you read it? This article right here. I've got the science. There is a journal article, but
yes.
Let me just read the title to you. Sleep deprivation is an effective antidepressant for nearly half of depressed patients, study suggests. And they did a review of all the studies that they could find that were published, and they showed this is an effective, cost-free, side effect-free of relieving depression in half the people. I would say it goes further than half. But don't you think your doctor should be telling you about this as he or she brings out the prescription pad and writes Prozac or Paxil or some other antidepressant for you? Don't you think the doctor ought to mention this? And by the way, one way, but the problem is the patient will come back, and they do this to me a lot. They come back, they say, yeah, but doc, one of my problems is that I can't sleep because I'm so depressed. Well, that's discussed in my 2004 newsletter, and also these people are aware that that's a complaint of people that they can't sleep. But as it turns out, that as you actually look at things carefully and measure things, they're sleeping, they're in bed, and what they need to do is they need to stay out of bed. You just can't lay there for 6 hours awake and then get your 6 hours of sleep. You need to stay out of bed, pick a time you think you need to sleep that's enough. You say, I think 6 hours is enough for me. I'll see how I do. And you set your alarm, you get 6 hours, you see how you do that day. Have you relieved fatigue? Do you feel rested? I bet you'll find you do. And how's your mood? Well, I'm not quite as rested as I like. So, okay, try 6.5 or 7 hours. Great tool. Talking about it again, published September 19th, 2017. Another article. This is from University of Pennsylvania School of Medicine. It'll go no place. Why?
Because it doesn't make any money.
It's self-controlled, self-administered, cost-free, side effect-free, and no drug company can market a pill that that cures the problem like controlling your sleep a little bit. Anyway, you can look this article up. It's easy. I know you can go back and you can freeze frame it when you play it back. You can look up the article from Science Daily. It's actually in a published journal of Clinical Psychiatry. But they talk about it here, and I thought this would be a good article. Give you one more chance. A good chance to look it up. Yes, but don't overlook it. Part of diet, which is, I hate diet and lifestyle, but part of the diet and lifestyle statement, which always goes on. You see, when you say diet and lifestyle, then you don't really have to change your diet. You just have to think about lifestyle, like think about getting more exercise. But things in lifestyle, independent of diet, are important. You need to have adequate sunshine. You need to walk around, get a little exercise. Yes, you do. And you need to have proper sleep hygiene. Many of my colleagues, and believe me, they are personal friends, and I have great respect for them, are pushers of sleep. I still disagree. 2004, let's see, that I wrote about it. Yeah.
Yeah.
Anyway,
Well, Dr. McDougall, isn't sleep something to be compared as to like eating or breathing? Like aren't you supposed to sleep until you're done sleeping and then get up? Or I mean, or am I supposed to force myself to get up at 5 in the morning? I mean, how do you?
what I see happening is this. You know, in my personal life and also people I've talked to about it, is they like people like to sleep. I mean, that's a really interesting state of mind to be in.
Hmm,
It's relief. You're in a dream-like world. So there's a lot of appeal to sleeping. And
right.
then again, there are people who follow the recommendation: get more sleep, get more sleep, get more sleep. Well, in fact, the sleep National Sleep Foundation, you can look it up. They go around to radio and television shows, and my guess is they've been on the big TV shows. And the National Sleep Foundation, and they promote getting more sleep to avoid traffic accidents and feel better.
Right.
So they have active campaigns, media campaigns, the National Sleep Foundation, to encourage you to get more sleep. So they say, more the better, and you try and get more sleep. And so maybe one night you get 9 hours or 10 hours or 12 hours. You say, okay, I did it. I did it one night. The next night you try it and you try and you do, okay, you can sleep that long. You're staying in bed. And the next night you just plain and simple can't go to sleep. You have insomnia.
Right.
You've overcharged your batteries.
Mm-hmm.
So, yes, you need some sleep, Gustavo, but it's a tool. It's a tool. Don't be misguided, just like the dietary misguidance and exercise misguidance and vitamin D.
Right.
They're all profit-based messages. What would you expect?
Right. Yeah. Well, I guess it depends on people. I mean, I really don't like to sleep.
Excuse me.
Yeah.
I missed my whole point.
Okay.
That's my whole point. The National Sleep Foundation, you can look them up. The National Sleep Foundation. Look deeply and see who would like you to get more sleep.
Oh, I see.
Who would want you to get more sleep? And pay money to tell you to get more sleep. And if you don't get enough sleep, then you must be sick. And when you're sick, you must take pills.
That's right. There's something wrong with you.
Who supports the National Sleep Foundation? Last time I looked, it was 3 or 4 different drug companies that sell sleeping pills. Oh, wow. What a coincidence. The National Sleep Foundation. Well, anyway, that was my point.
Well, good. Thanks, sir. It's such an interesting topic. And, I think 2 or 3 months ago, Dr. Lyle spent a lot of time in one of our webinars talking about sleep. So people can look it up again. But thank you for bringing it up. Very, very interesting.
I did, Gustavo, because it's current. They're starting to talk, or they are. I mean, it makes news.
Yeah.
But it'll be forgotten. This is not a tool that will be taught by physicians, unless, of course, we have a change in the motivation of medical practitioners.
Right
now, it's fee for service. It's unit productive value. That's how you get paid. The more units you do, the more you get paid. So whatever you do, the more money. That's the way our financial system works.
That's how it works. Well, Dr. McDougall, let me ask you a question about something related to the START solution, because I've had several people ask this. So let's see if we can get an answer to all of them. People in general when they read your book, have this one question, and they're afraid that if they are insulin resistant, that the START solution is going to make things worse. Can you say something about this? And there is someone actually on the webinar today that is asking that. Says, just read the START solution. Does this work also for those with insulin resistant issues? I'm afraid to make things worse.
Yeah, that's such a basic question.
Yeah.
And we have to start with what causes insulin resistance. And you would think that if you could get rid of insulin resistance, that would be a motivation. That would be your goal, to get rid of the insulin resistance, because you think that is your problem. Excuse me, that's just a normal adaptation that the body makes because of the way you eat. It becomes insensitive to insulin. It's a survival thing. So you develop insulin resistance, insensitivity to insulin at the cellular level, so that you don't keep gaining weight. I mean, you gain 40 pounds, 50 pounds, 70 pounds, and then you stop. Most fat people are only fat. You can convert to kilograms, but are only fat to the point of 30 to 70 pounds overweight. Most. Occasionally, and they stand out to you and I, you see somebody that's carrying around another person or two. And I see these people as patients. They're 500, 600 pounds. And you look at them, and you, I know you do, because I've had too much experience, so I don't. But you look at them and you say, look at this person's like 300 pounds overweight. They must have diabetes and high blood pressure and high cholesterol and bad arteries. Well, they've got bad joints of the lower extremities, obviously, but they don't have any of these problems. They don't even have high blood sugar. Why? Because they don't develop insulin resistance. Most people do, but they don't. And so the insulin keeps working, and insulin pushes fat into fat cells. Under normal circumstances, and that means you I'm talking to, when you get to a certain weight, the body says this is no longer in your benefit for survival to keep gaining weight. You can't climb the tree to get away from the saber-toothed tiger. You can't fit through the cave entrance to get sleep in safety at night. You're just getting too fat. So what I will do, the body says, to survive, because the body's always wanting to survive, I will, at the cellular level, decrease the function of insulin. In other words, I will cause insulin resistance. And most of it is done at the cellular level, just to keep you from becoming 2, 3, 4, 500 pounds overweight. So insulin resistance is a normal, natural development as a consequence of you being too fat and having a normal body that makes normal adjustments, so you don't get to be, extremely obese. So you say, well, then what you've told me, Dr. McDougall, is insulin resistance is not a disease. It's a normal adaptation. Maybe what I ought to do is work at getting rid of my insulin resistance. Well, how do you get insulin resistant? You get too fat. And how do you get too fat? You eat the American diet. So what you do is you lose weight. Any way you lose weight. You can have your stomach operated on. You can go on the Atkins diet. You can starve. Any way that you lose weight. Of course, all those methods are not recommended. The method recommended is to eat what I suggest, and then you lose weight, enjoy your food, and everything else gets better. When you lose weight, what happens is the cells become insulin sensitive. The insulin resistance goes away. So if you think you have insulin resistance, why don't you just cure it? And why don't you just cure it the right way, which is by eating what I suggest, and the insulin resistance goes away. Just eating carbohydrates makes the insulin go away without even the weight loss. It was shown by Brunzell from University of Washington, his group in the New England Journal of Medicine. I may have the date wrong, but I think it was 78 in the New England Journal of Medicine, maybe 81. They tested type 2 diabetics, and they fed them a diet that was 45% sugar. Let me say that again. 45% of the calories came from sugar, which is like pure sugar or maltodextrose. 45% of the calories. That was their baseline to start out. And then what they did is about double the sugar intake to 85% of the calories. Sugar. Brunzell, University of Washington, New England Journal of Medicine. And what they found is every aspect of diabetes improved. Fasting blood sugars, 24-hour sugars, insulin levels, everything got better just by changing the source of calories. And this was to a bad. Well, certainly not health food, sugar. And the insulin resistance disappeared just from the change in food. Now I had weight loss to it. Yeah. So sugar, carbohydrate is the way to increase insulin sensitivity. And those were the words they used in that article by Parcells. It decreases insulin sensitivity, fat does, and carbohydrate increases the sensitivity to insulin. Yeah, that's how they describe it. You can read the article. So you're worried about eating starch because you have insulin resistance. Have I answered your question? Get rid of the insulin resistance.
That's right.
And you want to get better right away? Just change your fuel from fat to carbohydrate. Even pure white sugar, as Brunzell showed. But that's not what I'm recommending. What I'm recommending is starches, vegetables, and fruits. Anyway, the insulin resistance goes away, you lose the weight. Golly, everything just seems to work. I wonder why.
Yes, maybe it was meant to
Maybe
be.
it's the food.
Maybe it's the food we were supposed to eat.
Just think about it. Could it be the food? I have people who tell me now, professionals, really make a big point about it, worldwide professionals, who still say diet has nothing to do with disease. They're still teaching that.
Oh, it's
I know.
Scary, yeah.
Well, it is not going to change. Basically, the money is what's selling you rich food,
right?
And the follow-up. Once you eat the rich food, remember the follow-up. Big pharma, big medicine, big hospitals, big physician business. There's a lot of follow-up money to be made too from making sure you eat the wrong food.
Right. Well, Dr. McDougall, people here are saying that thank you so much for this. It's the best explanation they've heard of this topic. So,
by the way, that discussion of insulin is easily found on my website. And how do you do it? Well, you could use the search engine, or you could put diabetes normal adaptation, which I think is the title of the article. But you could go to my hot topics, look under diabetes, and one of the articles is type 2 diabetes is a normal adaptation. And it's a whole article about what I just talked to you about insulin resistance and how carbohydrate improves it. All that stuff is an article I've written.
All right. Great.
Normal adaptation is type 2 diabetes. It's not a disease. It's the body just trying to survive.
Right. And again, that search place that you have in your website, it's the place to go because it's amazing. You can get everything there.
I use it every day. If I use it, find things that I've written.
Dr. McDougall, another common question people have when they start following the starch-based diet and following your book is that they say that they feel more tired than usual. And now, could it might be that maybe they're eating too many non-starchy vegetables and not enough starch, or what else could it be?
Yeah, that could be it. People are still trying to have the same portion size.
Right.
And as you know, you and I eat 2 to 3 times as much food as quote the normal person does. So you may be starving. One of the secondary side effects of starvation is the body says, well, look, you don't have enough calories, you can't move. You're going to be fatigued. Kind of sit still. So that's a normal adaptation to food deprivation is to be fatigued. So one of the problems when you switch to a starch-based diet may be that you're not eating enough food. It could be, but you started out the conversation, Gustavo, at least what I heard, could be incorrect, that a lot of people complain of being more fatigued. I don't hear that. I rarely hear from people. I do hear it, but it's I believe this. I think a general statement is true. I believe the reason they feel more fatigued is because they were told they were supposed to feel more fatigued, and that where you get energy is from eating protein, which of course is the meat, dairy, and fish industry's marketing pitch to you. So obviously, since you learned all your life that if you give up the foods that I ask you to give up, logically, you should expect to be fatigued. And I think that's a lot of where it comes from. And I'll end that statement by referring you to the fact that athletic competitive winners eat starch as the primary food source in their diet. And that means athletes from 2,000 years ago, known as gladiators, they were the barley men. I don't think they were fatigued out in the Colosseum, or didn't appear to be. You know what the result of being fatigued in the Colosseum is? You end up with 3 holes in your head. So they knew, or their owners knew it was important to eat starch. And athletic winners today live on starch-based diets. So if you're fatigued, talk to the last winners of the Chicago, the Boston, and the Honolulu Marathon. Ask them if they feel fatigued. The winners, they were Kenyans and Ethiopians, and their diet was 100% starch, corn, basically. So if you're fatigued, it's not a consequence of you eating the fuel that powers winners. And I've written, of course, several articles on that. I think July 2015 newsletter is one on athletes, July 2015. And then there's another one I wrote. Actually, it starts out with the cover of Carl Lewis from Runner's World. That's in that newsletter about athletes. The cover of Runner's World pictured Carl Lewis. Most of you are old enough to remember Carl Lewis, the fastest man in the world. He won a 100-meter dash, according to this article, eating the McDougall diet, and uses that name in the article. He set records for the 3 longest long jumps. As far as I know, they still are held by him. I'm probably out of date on that. But he also won some gold medals as an old man. The article starts out with the cover of that Runner's World magazine with that picture of Carl Lewis. Anyways, he was on the McDougall diet when he accomplished all
that's wonderful. Yes. So I don't know. Yeah.
It's the athletes today. The winners know what to eat.
I thought that's the only thing that crossed my mind. My plate is always 80% starch. I have more energy. I always have way more energy than what I use, I think. But that's what I've been thinking. Maybe that there are people that are still in the diet mind, previous diets, maybe controlling the size or eating more greens. And
Gustavo,
that's not going to do it.
We see this at our clinic all the time.
All the time, yes.
All the time. These previous habits that we've learned, people bring them. And even though Dr. Lim and Dr. Lyle and Jeff Novick and I and Mary, we just work really hard to try and give them another point of view. I still observe people. I eat lunch and dinner with them quite often at the program. I still observe them, eating big plates of salad or regretting, or actually more than regretting, denying themselves of a second plate of food. I go, come on now. You spent good money to come and listen to us. Why don't you do what I ask you to do, which is to eat? And that I didn't say eat salad. I said eat starch, pasta, and all kinds of delicious things.
Oh yeah.
Most of them get it, but I have to say, I'm sure that even the 10 days of high-powered brainwashing that we offer, there are some that 10 days of it's not enough. It takes them several more years, another bypass, or maybe a breast amputated, or and then they start rethinking again. By the way, By the way, now that we've mentioned breast cancer and mastectomies, you asked me because you think it causes greater interest in our audience, and that may be true. But I'm kind of running out of new things to talk to you about. So I felt that it might be really important for me to try and update some materials, and this may end up in a republication of one of my most important books. I think probably the most important that was written a long time ago. There are chapters on cancer and osteoporosis and heart disease and arthritis and kidney disease, all kinds of things. It says so right on the front, so it must be in there.
It is a wonderful book.
You say this was written a long time ago. It must be all new stuff. This McDougall's out of date. Well, I just started taking the topic of breast cancer up to find out what's been written currently, what's being written currently in the scientific research about the treatment of breast cancer. And I was hoping that this month's newsletter will come together, and I will end up hoping now. It's not done yet. I'm working on it. Really got almost 2 weeks before it's due. I was hoping to present an update of what's going on with the treatment of breast cancer. And I'll just give you some general thoughts. Aggressive treatment is rising, even though all the scientific community knows that aggressive treatment is doing terrible harm. There's more aggressive treatment done these days than there was back when I wrote the book or got a law passed in Hawaii against doctors for doing aggressive treatment. There was a temporary reduction in aggressive treatment, but it's way up now. We'll talk about that. And we'll talk about the studies on the new treatments and how they benefited people. Hint, they haven't, but I'll go over that literature with you. So I spent probably 2 or 3 hours a day for the last week. And for the next week or so, I'll spend a couple hours a day talking about the treatment of breast cancer. And this article will be on local treatment, the breast area. So you asked me to get themes and try and get a book or something I discuss to keep our audience interested, Gustavo. We do want to keep you interested. Well, maybe what my thoughts are now is I'll go through these topics. I only know a certain number of things as an internist. There's only about 10 different diseases I know how to treat. And right. I thought maybe I'd just kind of revisit all these diseases I've been treating for a half a century and see what the research has said since I wrote this book. And the answer is nothing important.
Right.
Confirm that what I said 30 years ago is true.
It's still true.
Anyway, I'll try and get a theme for our webinars.
Yes, I think that we had quite a few people asking for maybe a month of women's issues that you could address.
That's another book. We've thought about that, and I own.
We did.
I own that book.
I think that would be just awesome, amazing if you could do that.
Well, let me give it some thought.
Give it some thought.
Yes. I can take the chapters out of that book, McDougall Program for Women.
Right.
Which I own the rights to.
All right.
And maybe, but we can go through individual chapters, but still.
That's your.
Well, that was at my peak when I was at my best.
Right. Dr. McDougall, can you say a few words? I mean, we all know, we've heard you talk about vitamins and supplements. Can you just talk a little bit about the K, if you want, the K vitamins?
K2.
Yeah, spatial, yes.
This is another popular.
Mm-hmm.
I hear it again when you bring these up, Gustavo. These are not distant subjects. I hear this from people who I contact professionally daily.
Right. Yes.
So I understand why you're hearing these things. K2 is a subtype of vitamin K, and maybe I'll just do a whole newsletter on the vitamin K2.
Yeah.
But I'll have to do a little bit more research. The body makes all the vitamin K that it needs, from plant foods. This idea that this subtype of vitamin K2 is something special. You must eat meat to get it. I mean, that's
Right.
one sub theme, but that's not the real theme. The theme is you must buy our pills. Anyway, yeah, we can go over that, but the K2 is just another one of those last stands for meat eaters. Actually, the last stand is B12. But we got to find something, some justification for what we're doing to ourselves and the planet. I need vitamin K2. I never heard of vitamin K2. I don't think we even discussed it when I went to medical school. It was not known as one of the 13 vitamins, which, as far as I know, there are still only 13 vitamins. Those are small, organic substances the body can't make. That's what vitamins are.
Right.
Actually, there aren't 13. There are 12. Because vitamin D is not a vitamin. It's a hormone. We've been through that 1,000 times. So there are 12 known vitamins, and the body makes 11 of them. Our human body makes 11 from plant foods. And the 12th is B12, which we've talked to about ad nauseum. Anyway, they'll find some other special thing about the carnitine or some special leukemia virus that you need to get out of dairy to make sure that you keep the rates of leukemia up in the U.S. That's what you're missing. Something like that. They'll have some theme to sell you their products. But that's a good idea. I should do a whole newsletter on vitamin K2 so I can talk from an informed point of view. Right now, all I can tell you is I've researched it several times in the past, and it's just, we don't use any negative words here, but it just ain't true. It just ain't true. But it's just the new theme.
Well, it just, again, it all goes back to an industry that is there to make money.
But as you say that, Gustavo, there's a part of you and I and everybody listening that says nobody could act that way. Nobody could hurt my beautiful daughter or, loving husband. Nobody would do that just to sell a product, make money. There's a part of us that says that. But there's another part of us that knows the truth. These people will do anything to make money. Anything. Write me if you know of an exception that money can't buy. I know happiness and so on. But they'll sell you anything they can sell you to make money.
Yes, and that is
business. Don't take it personal. It's only business.
Well, but I'm always amazed, even though I know this, what a wonderful job the industry has done to brainwash people's head. The other day I went to the bank, and I never talk about my diet with people because I don't want to get in arguments. But I don't know how the point how we started talking with the teller, and all of a sudden it's like, well, I said, no, she was recommending a restaurant that has meat, and well, I don't eat meat, and he said, oh, where do you get your protein?
Where do you get?
I don't know if I thought this industry has done an amazing job at brainwashing, because that's the first thing that comes up like that, and just like protein, anything else, vitamin B12, K, whatever it is, it's the industry.
Yeah, just business.
It's just business. Yeah, but like you said, part of us doesn't want to believe that. It's like,
I know.
How can someone hurt human beings and families?
How could people do 1 million cardiac stent procedures that have been proven not to save lives in the U.S. Annually? How could this exist? 1 million surgeries done a year, heart stents, cardiac stents. How could that possibly happen in a civilized country where 1 million unnecessary surgeries are done? And we're not even talking about diet, folks. We're just talking about standard good medical therapy as recommended by the American Heart Association and the American College of Cardiology. A tiny percentage of these interventions to the heart save lives. And we've talked about that.
Yes.
It doesn't really be chronic disease. It is the May 2015 newsletter.
Yes. Well, someone says, no wonder you woke up depressed, Dr. McDougall. I mean, just think, when you think about the industry and the power that they have, they can that can be depressing, I have to say.
Well, Gustavo, let me clarify. I woke up thinking I was going.
That's right, but not if you were.
I said today I'm going to be depressed. I can just tell it. And then Mary had to intervene and said, Could you give me a hug before we get up this morning? And darn it, she ruined my whole plans today.
Now you're having a great day. Plus, we're having a wonderful time here, and so forget about the depressing day. Well, Dr. McDougall, I think we're about out of time. So we'll get together in 2 weeks, because next week is Dr. Anthony Lim.
Oh, man. You guys are in for it. Dr. Lim is our medical director.
Yes.
All the patients that come through, along with myself, I'm directly involved. But Dr. Lim, and that's kind of interesting. I mean, it's a whole story. But when people hear about Dr. Lim, their first thought is, well, this is Dr. McDougall retiring. And then they get involved in the 10-day program. They go, how did you run this program before without Dr. Anthony Lim? I said, I don't know. I have no idea. It's almost 3 years now.
That's right. He does a wonderful job.
He's becoming world famous too.
Yes, yes.
When he joined us 3 years ago, he was already just kind of interested with Kaiser. But these days, Dr. Lim is becoming a very, very prominent speaker, and I don't know whether he wants all the attention or not, but next week you'll see why.
Yes, you will. So make sure you all go and sign up for the webinar. It's already on Dr. McDougall's website, and send us some questions for him. Okay. Yeah. Very good. Well, thank you again, Dr. McDougall. Yeah. Go have a wonderful day in sunny California, and we'll see you in a couple of weeks.
Thank you, Gustavo. As always, without you, we wouldn't have the chance to do that.
Well, this is a wonderful opportunity. Thank you again. We'll see you all in next week.
Yep.
Bye-bye.
Bye-bye.